If you're a new parent and you feel more anxious than you ever imagined you would feel, I want you to know straight away you're not alone and you're not doing anything wrong. That constant alert feeling comes from suddenly being responsible for someone who can't tell you what they need. And your brain takes that job very seriously. Because when a newborn arrives, your sleep gets broken, your routine disappears, and your brain stays switched on, even when you're exhausted. And granted, biologically that's expected. Because after birth, your protective instincts are turned right up to keep your baby safe. Which is why you notice every sound, every movement, every change, and your mind jumps to what ifs, especially in the middle of the night. Then you add advice from social media, the internet, and even your great aunt who hasn't spoken to you in 12 years. Suddenly, it feels like everyone else knows something you don't. But here's the key thing: anxiety in new parents usually comes from uncertainty, not from a lack of ability or lack of love. You're worrying because you care, and because your brain is doing exactly what it evolved to do. In my work, I see capable, loving parents every day who are deeply worried about behaviors that are completely normal. Because honestly, most newborn behaviors look quite alarming before you understand the biology and physiology behind them. This video isn't here to dismiss your worries, far from it. It's to clarify what's normal, what is expected, and when it's worth getting checked. And once you understand that, the fear softens, and we can move through these worries with far more confidence. And in the next chapter, let's talk about the first major worry new parents have: crying that feels impossible to soothe, something every parent has felt at some point. So, with all of that heightened alertness we just talked about, one of the biggest worries parents bring to me is crying that feels impossible to stop. When your newborn cries like this, it can feel overwhelming, especially when nothing seems to work. Trust me, every parent has gone through this. It's such a common situation that many parents end up worrying that they've missed something or that they should be able to fix it faster. But most newborn crying comes from overwhelm because their nervous system is still immature and learning how to cope. Even small things like bright lights, fast movement, noise from the next room, or even too much handling can push them past their limit. And when that happens, crying isn't bad behaviors, it's communication. It's the only way they know how at this age. And you might even notice their body feels tense, their fists are clenched, and their movements feel jerky, all completely normal. Because what they need most in that moment is containment, closeness, and simplicity, just like any of us would want also. Bringing them close reduces sensory input and helps their nervous system feel safer. Neurons stop firing gradually, which is what helps. In fact, you'll often see the crying change first before it fully stops. That's a sign their body is beginning to settle, even if they're still upset. Look out for it. Many of us parents think this means we're doing something wrong, but in reality, it just means their system needs a bit more time. Sitting down, slowing your movement, and breathing calmly helps them regulate through you. Because you see, newborns are like sponges. They borrow tips and tricks from their caregiver because they don't know any better yet. This is why crying like this, especially in the early weeks, is very often completely normal. And it definitely doesn't need to mean that they're in pain or that you've failed at parenting. All it means is that your calm presence matters more than any technique your great aunt told you about. And as a reward for being calm and present with your child, you will see that over time, their ability to cope grows and these episodes shorten. This kind of crying is distressing, but it's usually part of normal development. And next, we'll talk about sleep, because that's another area where normal can feel very wrong. Let's talk about the worry that comes once the crying settles, which is sleep. Sleep that feels completely broken. Parents often come to my clinic and tell me their baby only sleeps in short bursts and wakes the moment they're put down. And of course, that can easily make you wonder if something's wrong or if you're doing sleep wrong altogether. But here's the truth: newborn sleep is biologically very different from adult sleep. It's actually worlds different if you knew the whole physiology. For example, they don't move smoothly through long sleep cycles yet, like we do in adult life. And because of this difference, frequent waking isn't actually a failure, but rather how their brain is wired early on at this stage. Because of this difference, many newborns wake fully when they transition between sleep stages, all because their sleep cycles are short and light. In fact, their sleep cycle is only 45 minutes long compared to our 90 minutes. But a brief stir here and there doesn't always mean they're awake or need intervention. It's best to sometimes take a pause for a moment, check properly, and allow them to resettle on their own. Because as if you do this, what you will see is that when they do go back to sleep, they go into even deeper sleep. And you may ask, is this a bad thing? Short answer, no. This is normal early sleep development and no bad habits are forming. Actually, predictable routines help signal safety and prepare the brain for rest. And simple routines done consistently over time matter far more than exact timings. So, no, your baby isn't broken or has bad behaviors because their sleep looks messy right now. This stage will mature and improve gradually as their nervous system matures and they have more control over it. But most importantly, your calm presence helps them learn how to settle over time. And with time, sleep stretches will lengthen. As long as you remember, this is going to happen gradually, not overnight. To recap, broken sleep in the newborn stage is exhausting, but usually very normal. Just give it time and a lot of predictable closeness. Next, we'll talk about feeding worries, because that's another area that causes huge stress. After sleep, the next big worry parents talk to me about is feeding and whether their baby is getting enough. Feeding can feel stressful because it's one of the only things you can measure, and yet it still feels very uncertain. Many parents track every feed, every minute, and every milliliter trying to find reassurance. I know I did at the start. But newborn feeding patterns are naturally inconsistent, especially in the early weeks. Trust me when I say, it's normal for babies to pause, unlatch, daydream, go for a picnic, or take breaks while feeding. That doesn't mean something's wrong, it means they're listening to their body, and by and large, we need to listen to it also. Also, bear in mind, a newborn stomach is extremely tiny, and it fills and empties quickly. So, what you'll see as time goes, feeding volumes and durations naturally change throughout the day. One shorter feed doesn't cancel out a longer one later. In fact, it's best to look at trends than focus on single or few feeds. Because what matters more is overall intake across the day and weeks, not perfection at each feed. Remember, babies aren't robots, and feeding isn't meant to be identical every time. It'll be different each time, in fact. A baby who pulls away content is often telling you they're full, for example. It may be a smaller feed, but they're content. You can also look for cues. Relaxed hands, soft arms, and calm breathing are powerful fullness cues. In my experience, and many veteran parents will agree, these cues are far more reliable than strict numbers alone. Plus, over time, as they mature, babies learn to regulate hunger and fullness very effectively. Though despite this, it will still be normal for feeding needs to change day to day, especially during growth spurts. My recommendation, keep responding to their cues, because this builds trust and supports healthy feeding long term. You may ask, though, does this spoil the baby? The simple answer is no. You're not spoiling them by feeding responsibly, you're teaching regulation. And what I notice a lot in my clinic is that most feeding worries come from uncertainty, not from true feeding problems. Now, the important stuff: red flags. Red flags are about growth, wet nappies, and overall alertness, not single feeds. If those are on track, feeding variation is usually normal. If your child starts dropping centiles on the WHO growth chart, then that's a worry. To recap, feeding that feels unpredictable is often part of normal newborn development, and most parents, you included, are doing perfectly fine. Understanding this removes a huge amount of pressure, on top of the already huge amount of stress and pressure you're likely carrying anyways. So give yourself a small break and don't measure each milliliter of feed. Next, we'll talk about breathing noises. Now that we have feeding under control, let's talk about breathing. This is another area that parents come to me about worried. Concerns such as their newborn sounds noisy even when they're asleep, or breathing is worse when sleeping or in certain positions. And yes, it can be frightening, because there is a spectrum of breathing sounds, from snorting, grunting, squeaking, or wet sounding breathing, and these can change between one another also. And add that to when you're already tired. Your mind can easily jump to something being seriously wrong. But from someone who spent a lot of time taking care of children, let me clarify. Newborn breathing is naturally noisy because their airways are very small and still developing. And they're also predominantly nasal breathers. That is to say, they breathe through their nose most of the time, and which makes every sound louder. This is because their noses are tiny, where mucus, milk, and even saliva can sit in the back of the throat and create gurgling sounds. This is why a lot of parents come to me worrying that they notice their child's breathing changes, especially after feeds or lying flat. They even think that this could mean their child has reflux, which could be hurting their baby. Unfortunately, though, there is some truth to this worry, because the valve between the stomach and esophagus is still immature in newborns and young babies. But still, milk coming back up, like a small spit up or sitting high in the tract, doesn't automatically mean pain or damage. As a doctor, we look for babies who continue feeding, settle well, and are gaining weight. All these are great signs of a well growing baby. Other types of sounds you might hear are grunting and straining noises. These can also be normal because newborns are learning how to poo and pass wind. This is because they tighten their tummy muscles without relaxing properly yet, which creates noise and effort. Again, this can look dramatic, especially for new parents, but believe me, it's often part of normal digestion. So, when should we worry? Here are my three big reasons to worry with breathing changes. One, when they come with poor feeding, which is a sign of poor growth. Two, if breathing changes are associated with color changes, especially long spells, this could be a sign of respiratory or neurological issues. And three, if there is persistent distress. As a healthcare professional, we would always want to rule out reversible causes for this, such as a foreign object causing an obstruction. But if your baby is pink, feeding well, and settling between episodes, then chances are that things are still going well. And if you think you're alone with the worry, I have a lot of babies referred to me from other doctors purely for breathing noises who thankfully turn out to be completely healthy. But hopefully by now you can find some reassurance because now you know most strange breathing sounds can be explained by anatomy and physiology changes. In the next chapter, we'll talk about sudden behavior changes because that's another worry parents come to me with and is not talked about enough. Now that we've talked about breathing, the last big worry I want to cover is sudden behavior changes, because this one really catches parents off guard. Time and time again, parents come and tell me their newborn suddenly seems fussier, clingier, or just not like themselves anymore. And if someone close to me changed their behavior overnight, even I would be worried, understandably. But with newborns, things are a bit different. You see, newborn behavior isn't meant to be stable. Their brain is growing ever so quickly at this age. Actually, it's the fastest age of brain growth. There's rapid growth spurts, mental and physical changes, plus neurological development. How can one not feel different with mood, sleep, and feeding? So it's very common for babies to have phases where they're harder to settle for a few days. You might notice more crying, more need for contact, or suddenly wanting to be held far more than before. But the good thing is, we can predict when these changes may come. They often line up with developmental leaps, even if you can't see what they're learning yet. However, what ends up happening is that parents often blame themselves, thinking they've done something wrong to cause it. When in actually, most of the time, this is just them growing and learning new tricks, and not anything caused by you. So, what causes these developmental leaps? Well, as their senses mature, light, sound, and even touch can suddenly feel much more intense to them. This, coupled with new tricks they learn, like rolling or walking, means that even familiar environments can feel overwhelming for a short while. And what result do we get from this? The need for more reassurance, more closeness, and more predictability from you, things they can rely on to be the same as before. So, what might seem like a worrying change is actually them developing in a healthy way, in fact. So the next concern comes to me in my clinic. If I give them more cuddles and closeness, am I spoiling them? And the easy answer is absolutely not. Because at the baby stage, we cannot control our emotions. We rely on our parents or loved ones to teach us these big feelings. Your calm voice, your presence, and your routine help their nervous system settle again. But as before, behavior changes on their own are not worrying. But if there are other systems that are going haywire at the same time, We worry. These include poor feeding or weight loss, lethargy or change in energy levels and or difficult to rouse, such as you stimulate them but the response you get is reduced or negligible. In clinic, I see many babies who seem very different for a few days and then return to their usual
Looks
selves.
great,
I
Mom.
often
We're
joke with
both
parents
doing
stating they've bought the
wonderful.
wrong twin by accident. It makes them feel better, and hopefully so do you, because remember, sudden behavior changes can feel worrying, but they're very often signs of normal development. And now that we've covered these common worries, let's talk about when to trust yourself and when to seek help. Now that we've walked through these common worries, I want to finish by talking about something just as important, and that's learning when to trust yourself. When I became a parent, it felt like everyone else knew better than me, and that happens to most, especially when you're tired, overwhelmed, and constantly second guessing. You might even feel silly for worrying about certain things, or unsure whether you should speak up. But I want to say this very clearly: your instincts matter. My wife is not a healthcare professional, and her gut feelings have always been smack on. She spent more time with my baby than anyone else, and she was able to notice subtle changes that others missed. So if you ever feel something is amiss or something feels off, it's absolutely okay to check in and ask for help. Seeking reassurance doesn't mean you're anxious, overreacting, or doing something wrong. It means you're being a careful and responsible parent. At the same time, it's also helpful to know that many newborn behaviors look very dramatic, but actually are still normal. However, that balance between trusting yourself and understanding what's normal is what brings confidence. So, how do we decide when to watch and wait and when to get checked, you may ask? Well, let's go through the red flags we look out for as a doctor. These red flags are not here to scare you, they're here to give you clear safety boundaries so you don't feel alone with your worry. And before we start, remember this: most newborn worries are normal, and most babies you worry about won't have any of these. Red flag number one is feeding dropping off significantly and quite suddenly in a short span of time. That means your baby is refusing feeds repeatedly, feeding far less than usual for them, or you can't get them to take enough despite trying.
Just checking on you,
Red flag
sweetie.
number two is
Everything
concerns
is
about
perfect.
hydration and
You're
liquid
such a good
intake.
baby.
If you're seeing far fewer wet nappies than normal, very dry lips, or your baby seems dehydrated, that's a reason to get checked. Red flag number three is vomiting. That's more than a simple spit up. Spit ups can be normal, but repeated forceful vomiting, vomit that's green, or vomiting with a very unwell baby needs urgent review. Red flag number four is a baby who's unusually sleepy or hard to wake. If your baby is difficult to rouse, not waking for feeds, or feels floppy and unusually quiet compared to their baseline, get them checked. Red flag number five is changes in responsiveness, how they react to external stimuli. For example, if they're not making eye contact like
There
usual,
you
not
go.
reacting to your
Nice and
voice,
calm.
or their responses feel
Mama's right
reduced or
here.
absent, that matters. Red
Observe the
flag number
subtle movement
six
of the
is
ribs
breathing
during
difficulty,
inhalation.
not just
A
breathing
healthy
noise like the
newborn
ones we
breath is
covered earlier.
rhythmic and steady.
That means struggling to breathe, breathing very fast for a sustained period, pauses in breathing, or pulling in under the ribs when they breathe. Red flag number seven is color change of their skin. This can be the whole body or just certain parts. For
Oh my
example,
god,
your
his
baby
lips are
looks blue
blue.
around the lips,
He can't
very pale,
breathe.
gray, or mottled, and it isn't quickly settling.
You
That needs
alright, my
urgent
love?
review. Red flag
Alright,
number eight
sweetie.
is
Shh.
persistent distress or irritability that you can't settle
Don't go
despite
to
things that
sleep.
usually would settle them. That means crying or discomfort that doesn't improve with feeding, holding, changing, or comfort, especially if it's new or escalating. Red flag number nine is a fever or temperature concern, especially one you cannot reduce with Calpol or usual children's medicines. If a newborn has a temperature or feels unwell with temperature changes, it's always worth checking because newborns can get unwell quickly. Red flag number 10 is a sudden change that comes with other symptoms. Let me explain. A behavior change on its own is often normal, but behavior change plus any of these above is different and can be worrying. So, the way I want you to think about red flags is patterns and combinations rather than one small moment. And if you're ever unsure, Trust your gut and ask for help, because reassurance is a valid reason to be seen. In clinic, I would always rather you come in early and leave calm than sit at home worrying by yourself. You're doing a brilliant job, and with time, this will feel easier because you'll understand your baby better and you'll trust yourself more. If there's one thing I hope you take away from this video, it's that most of the worries new parents carry are not signs of failure, they're signs of love. You didn't suddenly become anxious when your baby arrived. You became responsible for something precious, and your brain adapted to protect them. That heightened alertness, the checking, the worrying, the Googling at 3 in the morning, it's incredibly common, and it does soften with time. In the early weeks, everything feels intense because everything is new. Your baby is new, your role is new, and your confidence is still forming. But confidence doesn't come from never worrying. It comes from understanding what you're seeing and knowing how to respond when things change. And little by little, you start recognizing patterns. You learn what's normal for your baby, not just what the internet says is normal. You'll notice that some noises, behaviors, and phases that once scared you now barely register. That doesn't mean you stop checking or caring. It means your judgment becomes more confident and more balanced. And on the days when the worry creeps back in, that doesn't erase your progress. It just means you're human. Remember, you're allowed to ask for reassurance. You're allowed to get things checked. That's not weakness, that's good parenting. And as we learned, most babies who look noisy, unsettled, or different for a few days are simply growing, adapting, and learning how their bodies work. But when something genuinely isn't right, you don't need to diagnose it yourself. You just need to notice and speak up. Trust that you know your baby better today than you did yesterday, and you'll know them even better tomorrow. Because this stage is loud, unpredictable, and emotional, but it's also temporary, even when it doesn't feel like it in the moment. So to clarify, you are not behind, you are not missing something, and you are not doing this wrong. You're learning, your baby's learning, and every day that passes, you both are in a better position than before. Together, you're doing just fine.